What's your experience day to day when it comes to dealing with patients as they're coming in? Patients who are testing for positive, patients who are kind of trying to figure out what's going on with them. What's kind of your day to day process that you're dealing with?
Yeah, so day to day, it's been very challenging. Every day is a different challenge. The one thing I'm noticing is that patients are certainly much more unwell than we initially thought. So patients have a tendency to really, really get unwell overnight. Patients that were fit in the day, by the time you come back the next day to see them again, they've had a couple of call-outs overnight to the medical team at night time because they've become very unwell, high temperatures, their breathing's become more laboured. So for me, it's been a real reality check and a real wake-up, really, because it's been patients who have not I've not necessarily had the experience of before treating these kind of patients who are very unwell. And I think day to day, the reason why patients are coming in is because they've self-isolated for 2 weeks and they've not got any better. So there's a real fear there that, are we going to die, doctor? What's going to happen to us? What's going to happen to our families? Can they come visit us? It's been a fear which has never been there before. Because, when someone is unwell, their first concern is, my family. Yeah. But obviously with COVID-19 patients, family can't come and see them. Yeah. So they have been really, really, estranged from their family in that sense. And I think that's been added fear, which makes our life more difficult because these patients are isolated. And in spite of our lack of PPE, we are trying our best to be covered as well. So obviously, when the family visiting hours, they've been, most hospitals in the UK have stopped visiting completely unless you're giving birth or unless there's a child who's got COVID-19.
Yeah. What has been the difficult kind of decisions that you've had to make during this time?
Difficult decisions for me have been about, because my ward is what we call a level 1 to level 2 ward. Level 1 meaning normal medical ward, level 2 meaning some of the patients, usually 3 or 4 patients from 28 patients are having CPAP, so that's continuous positive airway pressure, a tight-fitting mask, delivering high flow oxygen. So that's level 2 care. Level 3 care is the ITU. So for me, the decisions primarily have revolved around making decisions for who is a candidate for each level. There have been some tough decisions. As a doctor, you have to bear in mind the patient's clinical picture. So for me, just a couple of weeks ago when I first started, I think the decision was whether to make a patient end of life, which meaning he or she can't actually go beyond level 1 care on the ward. So for me, that's been quite a challenging aspect of the job. But something which I've learned over the last few days, and something which I relish over the next few weeks.
Yeah. So I know there's also been a shortage, especially for medical people during this time for the full personal protection equipment. Have you guys at your hospital been facing this, and how have you kind of handled that?
Yeah, so how our hospital's been okay. I know there are other trusts which are facing these difficulties. We had some good PPE coming over the last few days. There have been people donating PPE as well, and that's been very helpful. I think the ITU, so ITU, ICU, whichever you call it. I know probably in America you call it ITU. I'm not sure ICU, but
ICU,
yeah, ICU. Yeah, so we call it ITU here, intensive treatment unit. That's essentially. That's been pretty well staffed across the country. The doctors there, the nurses there have had full PPE cover. The problem arises in wards like the ones I'm covering, where PPE, you've got a 28 bed ward, whereas ICU is usually 6, 7, 8 beds, depending on the size of the hospital. It's quite a small, specialised unit. So PPE cover's been okay there, but on our ward where there's much more patients, much more doctors and nurses, it's been less readily available, and I think that's where the key lies in A&E and in the COVID wards, not necessarily ICU. And I think there was a comment from a doctor over the weekend in Wales, in South Wales, in Gwent Hospital. I think he was saying 50% of doctors, the half of doctors and nurses have tested positive for COVID-19, and that is again down to the amount of exposure they've had to the virus. Now, we know from countries such as South Korea and Taiwan, to drastically reduce the rates, to flatten the curve, the principle of damage limitation, which should be with PPE to frontline staff. And I think in the UK, the message is getting there, but very slowly.
I know also you have had a shortage in the CPAP machines.
Yeah, that's right.
And I know you were kind of waiting on those to come in. Have they come in?
They have come in, yeah. So we've had them redistributed from different wards, and they have come in. But the issue then lies with the nurses getting trained on how to use CPAP machines, because, like I said to you, most of the nurses are generally most of the nurses on the COVID ward, the wards which have been designated of COVID, are surgically trained nurses. So they're the nurses that look after drains and post-operative kind of problems such as hip replacements, etc. So for them to get trained on CPAP has been quite a life-changing experience, because CPAP is, as we know, a treatment for COVID symptoms. So it's essentially been a human factors limitation rather than machines. Machines have come in, but it's been people who have been trained on them, and I think that's slowly catching up now.
Okay, so pretty much all nurses have had to get training on this.
Yeah,
because they don't have the initial training.
All nurses, yes. So the medical nurses, the ones that actually dealt with respiratory problems, asthma, bronchitis, they already knew how to use CPAP machines and how to use the settings. But it's been a new nurse, well, not the new nurses, but the surgical nurses who have obviously had no work because of operations being cancelled. Now they've been reassigned to COVID wards, so they've had to be retrained or newly trained on CPAP use.
I know this is such a distressing time for most people. For you and your colleagues, how have you guys been able to manage the stress levels? Because obviously this has been a very stressful time for everybody, but probably it's definitely more stressful for you guys at times. How have you guys been able to manage that stress?
Well, it's not been the 2020 we envisaged. It's we heard about this pandemic coming from Wuhan, or we never thought we thought it'd be 10 cases in the UK. That's it. People who travelled to China recently, we didn't think it'll be over 50,000 with sort of 10,000 deaths. We didn't think that at all. We never really anticipated this deluge of patients coming in April, which is usually a good month. As you can see, it's quite sunny today. It's a nice time. The only thing usually is what I've got is hay fever. April is usually a time of hay fever, and nothing more than that, or a bit of asthma. So we've had a huge increase in the amount of patients. So going back to your question about how we manage, I think, collectively we know we're in it together. We're in this together. Having that collective team spirit, that galvanizing, the cultivation of team spirit really has spurred us on. We've had a lot of support from local restaurants, takeaways, cafes. They've given us lots of free donuts and coffee and all sorts of things, and that's been very useful. We had free pizza actually. Most nights of the week, free curry as well. Every time I come in the morning for my shift, there's a free curry or a free pizza from the night shift. So it's been very useful having local support from the community.
Yeah.
And I think as doctors and nurses, we've stuck together. We've constantly been messaging each other, how are you doing? Do you want a time off, or how are you feeling about work? And we've had allied health professionals help us out as well. So I've had a lot of messages from psychiatrists, from psychologists even messaging me saying, Dr. Asif, if you want any free CBT, let me know. If you want any PTSD support, and that's been very, very good.
That's amazing. What's the kind of things that you've learned going through this type of pandemic for you personally? How has it affected you, I guess?
Personally, on a personal level, the one thing I've learned is family comes first. A lot of the patients I've seen who can't see their family, unfortunately, have had to have their last conversation with their families via a phone. It's taken away the human element, from patient relationships. So for me, cherishing my family, spending time with them as much as I can away from the hotel, has been something which I will take away with me for the rest of my life. Whenever I get a spare moment, I'm going to take my son out, I'm going to take my wife out. I think that's very important to cherish family time, because what we've learned from this virus is people can die young. People, our age, 30s and 40s, they have died. And it's, you can't take life for granted. You can't say I'm going to be 80 and retire and have a nice life after that. This virus has proven you can be, perfectly good health and still die. So for me, as a doctor, I'm grateful for life. I'm grateful for the family I've got, and most importantly, I'm grateful for the profession I've been given, which is the ability to serve patients who are at their most needy time.